So I want to ask a bit of a critical question here is these discussions have been happening for a while. The need for sovereignty. It was obviously catalyzed by, President Trump's, USA cuts. But back in 2001, we had the Abuja Declaration, a lot of African heads of states committing to at least 15% of their national budgets towards health. Very few, I would say maybe, not up to five met that target. And so my question to both of you, maybe starting with Ngozi, is how do you see this movement different from the Abuja Declaration? Right? Is it something that that is different in some ways as opposed to what happened back then?
Yeah, thanks, Desmond. I think it's a really important question. And actually, Dr. Alosoji Adeyi, he, we all know his work. We know he's very prolific when it comes to kind of warning African countries to go forward and not go back, and also to have their own agency. I think that he and others, like Dr. Ebere Okareke as well, talked a lot about, how do we move forward and not kind of get not in 10 years look back and say, oh, we were at that that summit in Ghana. We had all this goodwill, but it didn't lead to anything. I think that, in the early 2000s, there were a lot of good initiatives, such as, the Global Fund and Gavi, and a lot of things that had been kind of resurrected to help African countries, but low and middle income countries everywhere to again, counteract the morbidity and mortality from infectious diseases. But one thing that Dr. Adeyi said is that none of those had a sunset date. It was just that they were supposed to be there in perpetuity, basically. Yes, with Gavi, you can graduate and as you become a wealthier country, but still, like, as with a lot of global health architecture as it is, it exists to keep jobs, right? Like, I think that was we might not like the way Donald Trump did things, and I really do not. It was abrupt and it was, destabilizing, and a lot of people will lose their health and their lives because of it. So I'm not saying that was good the way it was done, but the fact that it happened, none of us should have been surprised, really. Like, another country cannot provide health for a different country. That's just not how the world works, and that's not how we should want it to work. And so I think, of these structures that kind of looked like they were going to go on for infinity, they allowed African governments to really not invest as much as they should have in their own health system and their own healthcare platform. So Dr. Adeyi said a lot of things that I thought was really interesting. I'm trying to remember, maybe Dr. Victor, you would remember, but he talked a lot about like he talked about cycles of dependency. He had a word of basically saying that we've sabotaged our sovereignty by allowing these larger platforms and these larger programs to continually be a crutch for African countries. I think that's one. I think also that we can be more specific than what we had at the Abuja Declaration. I think that we can, like, again, as I said at the beginning, health is beyond the Ministry of Health, right? Like, when we talk about One Health, there can be programs that include, agriculture, animal health, that impact human health as well. And I think that when we think about, having 15% of, country budgets allocated to health, I think we need to really think about how that can happen across the government, actually. And I think if we're more specific and we give more direction and instruction, I think that we probably could reach those levels that we put out in the Abuja Declaration. So I think there's an issue with, defining it better and encouraging like this beyond health approach or health and all policies approach, as well as like these structures that were a crutch that allow for governments to kind of put all of their, vaccine responsibility, all of their response, like outbreak response responsibility, and all of their kind of the largest diseases that affect their population, those responsibilities in the hands of external organizations. And so hopefully moving forward, we won't do that.
Maybe just to add my 2 cents with, and Ngozi, I love the way you framed it. I mean, excellent points, really, really excellent points. Just to add a little bit of it to what you said, throughout the summit, I think it dawned on everybody. It's dawned on everybody from the beginning of this year that things are not, as they've been in the past. So there's a proverb in my language that actually, translated says, when you advise somebody, sometimes it doesn't go down. It's experience that makes people feel what is actually happening. So there was a lot of talk about this being an inflection point. That this time we really need to do. So Abuja was about how much. This time people were asking, how should we do it? Moving beyond just the domestic resource mobilization to the manner of engagement. The fact that they're talking about sovereignty, who should be at the table beyond health. And Ngozi has made that point repeatedly. So looking at it in a multi-sectoral manner, because it goes beyond just the health minister going to cabinet and asking for 15%. It goes to the finance minister saying, I need to pay for these vaccines because when I pay for vaccines and I look at prevention, it's going to reduce my cost when it comes to curative, when it comes to cancers and whatever, So there's a whole discussion. But I'll give you a few quotes that people made, because there was also the feeling that there's a threat that this will just be a 9-day wonder. I'll start with Dr. Ahmed Ogwell, of Village Reach. He said, what happens in Accra must not stay in Accra. I'll go on to what Alhaj C of the Kofi Annan Foundation said. He said, too many promises have been made, too many promises have been broken. This time we should try to do it differently. Dr. Tedros, WHO Director General, he said something profound. He said the difference between crisis and opportunity is leadership. And Africa should stand up and lead and move away from where we are perennially asking people to come and solve our problems for us. There was a certain feeling in the room that this time it's not going to be business as usual. And I do hear you, because there is that risk. But I think it behoves us to actually follow up on these discussions and action some of the things that we've decided to take up. Minister of Health of Nigeria, coordinating minister, the Honorable Mohammed Pate. I wish I could share with you the 15 points he made at the beginning. Fantastic points about where Africa finds itself now and why it's important that we either seize the moment now or we are lost forever. So I think we all left feeling a certain resolve that we're going to do things differently. And here I must pause to remember that unfortunately, the day after the 5th of August, we had a terrible helicopter crash, which took away 8 gallant Ghanaians. One who was sitting right next to me throughout the session, Dr. Omane Boama, who was also a physician himself, Minister of Defense, and one of Ghana's smartest politicians. Unfortunately, the next day, they were involved in a helicopter crash. But I say this, number one, to pay homage to them and to remember them, and to remember that some of them on that helicopter were invested in this. But secondly, also to give an example of how this slowed down the release of the communique and some of the other things. But immediately after the mourning period, and I think this is what the 8 who lost their lives would have wished for, we would slow down for a few days to pay homage and to pay our respects. But we are now back on track. I'm getting calls from the president's team in Japan saying, what are we doing about the UN General Assembly? What are we doing about getting? And interestingly, we're seeing some of these meetings being replicated around Africa. In Nigeria, I saw that there's a reimagining conference, and Nigeria has shown great leadership from President Obasanjo, who actually must be the one person we must thank for bringing this together, because I will not be able to say this, between President Obasanjo and Dr. Azegono, when there were threats to this meeting coming up, they actually pulled out all the stops to make sure that this came, So Nigeria, once again, congrats and kudos to Nigeria. I know Dr. Ngozi, but this is something that has come up and has come about because people think that this time it has to happen, and the examples are there for all to see. So we're not going to drop the ball at all.